Yesterday, I gave you an 8-question quiz to determine if you're a good dental leader. I'm going to give you the answers to each of the questions when we return. There's no right answers on the quiz, but how you answered can indicate some potential problems in your leadership. So let's look at the answers. Number 1, your employee's car trouble. If you answered A, you may lack empathy. If you can't put yourself in someone else's shoes, you're not likely to engender much loyalty. Number 2, composite verse amalgam. If you answered A, you may fear change. Leaders have to embrace change and seize opportunities as they present themselves. Number 3, you always compromise with the office manager. If you answered A, you may be too willing to compromise. A leader should listen, but a good leader knows when to stick to their plans. Number 4, do you demand the office manager make changes or ask for an exclamation? If you answered A, you may be bossy. Just because you're the boss doesn't mean you should be bossy. Number 5, you can't decide if your cell phone policy is fair or not. If you answered A, you may be wishy-washy. If your decision was well-reasoned, stick to it. Everybody doesn't have to like it. Number 6, you keep hiring bad employees. If you answered A, you might be a bad judge of character. That's okay. Find someone on your staff that is a good judge of character. Otherwise, you're going to keep finding yourself in the same situation. Number 7, you think your staff is incompetent. If you hired the wrong people, you could be right. But it could also be that you're a micromanager. Thinking you can do everyone's job better than they can is a practice killer. It wastes your time, it puts you under a lot of stress, and your staff will hate you. Maybe you can do everybody's job better, but the bottom line is you can't do everybody's job. Finally, the last one. You're the first in and the last to leave. Shouldn't everybody else be as dedicated as you? If you answered A, you've lost perspective. It's okay if your life is out of balance, but you shouldn't expect that from everybody else. Unless they have some ownership in the practice, it's just a job for them. As long as they do a good job while they're on the clock, allowing them to have lives off the clock is normal. So how'd you do? On this quiz, I give myself a 0 out of 8. I don't think I answered A to any of them. If you answered A to one or more of these, you might have some shortcomings as a leader. If your practice isn't performing where you want it to be, the first place to look might be yourself. Thanks for watching. Until next time, keep moving forward.